side trays. And basically, he does an anterior approach 99% of the time now. So does any other surgeon here do anterior? Okay, so you guys are familiar with that and the positioning. So it's basically, he'll start and make his incision. He's going to start with the acetabulum. He will cut off the head, and then he will start to ream. This is the tray for that. The reamers are pretty standard. We do not use the straight handles. That's in this tray. We have a special tray for him. It's called the MIS tray. This is it right here. So what we will do is you would have to put together the handle to attach these reamers, okay? So it's gonna be 3 pieces, 1, 2, 3, initially, and then you have to put it through the actual handle. All right, so this is something I would want you guys to come and play with, because this is, I think, one of the most cumbersome parts, right? But again, I'm gonna be in the room with you the whole time. It kind of follows, see how it just kind of follows the groove? You're gonna cover the groove with the other half. Make sure it's closed completely, and then there's like a little lock on top. So you follow the divot, there's a little divot, and then you press it down, you release, and you twist it. So again, this would be something that of course, I want you to play with. And then this, you can orient it, right? Different ways. Push it all the way in, and this has to lock. And once you lock it, you can no longer adjust this handle. It has to be unlocked, and then you can adjust the handle. He likes the handle up like this. Doctor's preference. But again, nothing you have to memorize. I'm gonna be in the room. The most important, I just want you to be comfortable putting it together. Because of course I can't put on sterile gloves and help you, so that's, that's a little part. He's gonna tell you what reamer to start with. If he's doing, the cups come in even sizes, from 48 to 70. He always reams odd, so he reams one below the cup size he's putting in. So if he templates, let's say, a 56 cup, he usually puts 3 sizes below that, right? So 56 cup, you're gonna go 55, 53, 51. Let me go to 51. He usually reams 3 times and then puts the cup in. That's not always the case, but usually. And you saw how I put that in? All you have to do is snap it in. It's not, the only time you have to pull on this is to take it off. But to load it, all you have to do is snap it in, okay? Again, come up and play with it. Please touch and feel. Again, like I said, 3, put in the 56 cup, right? When you wanna put in the 56 cup, here's my 56 cup, give it to the nurse, she opens it sterilely on the field. This also has 2 ways. The same way this has 2 ways to ream, a straight and a curved. This has a curved and a straight inserter. He's gonna use the curved for anterior. If he does the posterior, he'll use the straight. But like I said, 99% now he's doing the anteriors. Handle, find the groove in the cup. You're gonna feel like a lock in. And then you take the inserter handle, attach it to this, pull it down like most, right? Make sure it's on forward, and then you lock it in. Put it on the cup, follow the groove, and I know it's difficult for you to see where you're sitting, and then you just tighten it down, okay? Again, that's something that you can play with.
Question for you. Do you suggest the scrub doing that with it still in the pack?
Yeah, it's not in the pack, but on top of the plastic. Right, always, because you don't want these porous material getting on your mail stand, anything that's in your mail stand. This is sterile. It's going to the patient. Okay, now the cup is in. What you're gonna do next is drill. He always puts a screw, at least 1, right? So there's gonna be 3 options of drill bits. Usually use the middle, right? Easy, just take the middle one. On power. I should have asked for a system 7 or something, but it's okay. On power, you can imagine, right? You know how to attach these to power. Pull it down, twist. That's it. Drill guide. He's a 30 degree, right? There's a 60 and a 30 degree option. He likes a 30 degree. He never measures. He usually puts a 30 or 35 screw in. I'll open it, and the way that you are going to put it in the patient is not with power, it's by hand. That same handle that you use to attach the cup to the inserter handle is the same handle you're gonna take off and you're gonna put the screw in. Same thing, pull it back and then attach.
How many handles do we get? One?
Yeah.
Okay.
But you'll
fine.
have time. And then you put the screw on top of here and you attach it like that. And he'll take it from you and he'll put in the screw. Then he'll ask for a liner. I'll open the liner. Depending on if it's a 36 head, a 32 head, or a 40 head, that's a ball I'll tell you to attach. And this handle is it. It's a lot of information. I'm gonna be there, my laser pointer. Don't worry, this is really, again, just so that the first time you see it is not when he's here, right? Am I going too fast? You guys are good so far? Any questions? Because now we're done with the cup. And we're gonna go into the femur. Okay, you're good so far? All right, awesome. Okay, so once we're done with that, I think that's the hardest part of the surgery, right? Because then now we just go to the femur, we'll use some different retractors, and he'll broach, and then I'll open the stem, right? But I'll go a little bit slower. But this would be a stem that we would open and we would insert it, and then that's it. But let's go back a little bit. So we have the broach, we have especially anterior handles. My drivers didn't bring it, but it's okay. It's just a handle that you would put it on. It looks something like this one. Only it's curved. It's the same thing, right? Because all these instruments are going to be tailored for anterior. So instead of a straight handle that he would use, again, if he was doing posterior, he would use a curved one. But it's the same concept. You simply attach it, close the handle. The only thing is that the curved handle is not here. And then he will do a canal finder. Do you have total joints here? Is this like foreign to you? You guys done this, right? It's not foreign, right? Okay. All right, so then after that, it would just be a matter of canal finder and then start broaching. Two options, linear is on top. This one that I took the handle out is taper fill, 99%. He's using linear.
What's the difference?
Linear, taper fill, right? One is longer, right? And one is smaller. So if a patient is small female patient, very small canal, we're gonna use a taper fill. But he usually likes the linear. For the anteriors, he says it's easier to get that channel, okay?
Can you chuck one up on the broach? Can you broach one
Oh,
of these?
sure. It's the same thing as how I put the last cut. Easy, very easy. Once he likes the size, he'll say, okay, I'm gonna trial. Again, 99%, he likes lateral. So he has a broach in, the patient, you're gonna pass him the lateral trunnion. He's gonna say, I want a neutral. Neutral is blue. I'll tell you, give him a blue head, put it on top, and he'll reduce. Remember, everything in the cup is in. The cup, the screw, the liner. So now, that's the implant, and now he's trialing. This doesn't stain the patient. He'll say, okay, I like this, Angelica, open up a 7 stem. And then I'll open the 7 stem, okay? So this would be a real stem. This is the liner already in the patient inside the cup, but then this is the ball I'm gonna open. This is the ball I will open. This mimics this. Sorry. I need more hands, okay. So if I open up the real thing, I don't need this trunnion anymore, right? So a lot of times what he'll do is, I open up the real thing, but he still wants to trial to make sure before I open this last piece. Make sense? So he'll say, okay, let me try one more time. When he says I like it, then I'll open this ball with the little sleeve inside. That looks like this. The pink ball and that little metal sleeve inside. And your case is done. So reduce.
What impactor do you use for that? That's the final.
That's the final. Put it together. This is for your stem. This is the one he likes. It doesn't screw in. He'll place it in the patient and just put this and advance it with the mallet. What else can I tell you? Calcarine. Sometimes he uses that. This is the small, and I will always provide you with a large as well. It should be on the bottom of this tray. Let's see. Yes, it is. Okay. So this is a small, and this is a large.
That's the small?
No, this is the large.
Oh, okay,
and
okay.
This is the small.
Okay.
Yeah.
Also, after the drill bits are used, are they reusable or disposable?
They're reusable.
So they go back in the tray?
Yes, Synergy has the replacements, and if it's no good or I see it's dull, if it's giving me a hard time, I'll tell you to dispose of it.
And
then
they'll
I'll
refill.
call Synergy, and I'm like, please make sure this tray.
But we're putting it back in the
You're
tray,
putting it back
cleaning
unless
off
I tell
bone, and okay,
Yeah, just everything goes back.
okay.
Because with Synergy, you just have to do that. Any questions?
I got 3 questions.
Sure.
First of all, does he use a regular bed or the active?
He uses a regular bag,
Okay. What is his average length of procedure?
an hour.
And does he use spinal or intubation?
Spinal. Depending on, if the patient has any issues or concerns, that's a really loaded question, depending on the patient's health. But 90% of the time, we're gonna try to do spinal.
X-ray
welcome.
intraoperatively or postoperatively?
It's gonna be in the OR.
Intra.
So intraoperatively.
Does he use any bumps under the patient or anything?
No, so,
Gel bump or anything?
no, not really any, unless you have the gel pad, but we didn't make up the bed like that.
So the bed is just a totally normal straight
Total
bed?
normal bed. The patient's just
No
lying.
onboard on the side?
The arm, regular, regular,
Okay.
yeah, nothing, no. Some of his, one of, oh, okay, no, we don't do that.
Some surgeons do that.
Okay, we'll have to actually put a, Mayo stand, additional Mayo stand, because he will have the patient, the bed flexed, and the leg, the non-operative leg will go on top of the Mayo stand at some point during the surgery. So you have to have an extra Mayo stand prepared with towels on it, because he will put that leg on. Any other questions? One of the PAs does like to put a sling on the non-operative side, on the operative side, so it's not in the way of when you're taking x-ray. So they'll put a sling, I think, is it in the back? The back of tricks, I think. On the operative side. It just helps to get it out of the way, because there's 2 people standing on the side.
So in other words, tuck the arm. They're tucking the
You
arm.
can tuck it, you can put a sling, that's what I'm saying, it's PA's preference, right? I mean, his PAs are coming, so I think they'll take care of that. I don't think that's really, you guys have to worry about that.
Well, we do, because we have to make sure that everything is appropriate and there, and that the arm is protected and.
What I mean is that they'll probably come have a conversation with you, because it's not like one set way. So, of course, it's ultimately the circulating nurse's responsibility, I get that, but I just mean as far as you having to memorize anything like that, I think, they'll come and you guys will discuss, well, how do you want it, and, because, every PA is different. But you guys set the rules then, you'll see how you like it the best, and this is what works best in this room, it's a small room, it's a large room, it depends also where we work, right, and the space and the capacity of the room.
What type of antibiotic irrigation does he use?
He likes Irricept. Yeah. And did you see the napkin cocktail? I'll send it to you. He uses napkin cocktail at the end.
You have that written down somewhere?
Our pharmacy makes it, yes. You want to know it now? I can tell it to you.
We'll get it after. We'll
Yeah,
get everything
I
after.
took pictures of
I'll get everything
because
after.
I don't even remember it anymore, because pharmacy now makes it. We used to have to make it, but now pharmacy makes it.
So he doesn't use a pulsatile lavage at all?
He does. He uses the pulse lavage, which is gentamicin, to irrigate. but also he also uses, I'm sorry, you did ask that question, but I'm thinking Aricept is separate. Because isn't that standard? Does every surgeon use? No. Oh, okay. Our surgeons all in our total joints, they all use gentamicin. 160 milligrams.
Only?
Excuse me?
Gentamicin only?
Yes.
And that's 1 gram?
160, 160, so each little vial has 80, so it's 160 in a bag of 3,000. And then you attach it to the pulse.
160 and a bag of 3,000.
Yes. But I have everything right, I mean, you
I know,
know.
I just.
No, that's fine.
He's
I like that.
he's the joint guy.
I like that, I like it.
What about sequential on the opposite leg, or does he put that on at the end?
No, we prep both legs.
Really? Oh,
You
we want to
do?
be able to see the hips and the legs.
Yes, yes.
What is used for prep?
Just regular, Chloracet, what you
Chloroprep?
guys do? Chloroprep. The sticks?
Yeah, the sticks.
Yes.
Lisa, don't write down. I'm gonna get you all the information. Don't write
But I
down.
love it, that's so, I love it. I would be doing the same thing, so that's fine.